Hey everyone, welcome back to the Take Back My Brain podcast. And I am here today and I have a special treat for you. This is Dr. Rebecca Warren. She is a chiropractor. She's also a functional wellness practitioner. She has an amazing story of her own that she is going to share with us. She specializes in thyroid, sex hormones, and in particular, she is a specialist, which there aren't very many around, in how to recover from a thyroidectomy. So she has her own personal story that she is going to share with us, and how she, with all of her own resources, because she didn't have anybody to help her, how she has come to the place where she is today. And I just want to say thank you, Rebecca, for being here. I'm so excited. How are you?
Good. I'm really excited to be here. When you reached out, I was like, heck yes, Laurie, I want to be on your podcast and chat with you about all things health. So I'm really excited to be here and I'm doing great.
Awesome. So I would love to just start out, kind of tell us your thyroid story, because I know so many of my listeners have thyroid issues. Some of them have had their thyroid removed. Some of them have Hashimoto's or hyperthyroid. Thyroid issues are epidemic right now. So tell us your story, and then let's just get into the nitty gritty.
Yeah, absolutely. So I always start off with sharing my story when I was 16, because I had a gallbladder attack. Okay. As I was walking out of a movie theater. The pain was so severe. I thought I was having a heart attack. I fell to the ground. I vividly, like there's memories that are kind of traumatic to you. So you have flashes of it. I vividly remember how dirty the sidewalk was, because I remember laying there not caring about how dirty it was, even though it was gross, because I was scared. I thought I was dying. I thought I was having a heart attack. They rushed me to the hospital. They told my parents I had like 1,000 stones in my gallbladder, but of course it's okay because they can cut it out, right? That's the solution. Cut it out, medicate it, radiate it, and they send us on our way. And the problem with that is that even at 16, I thought to myself, something doesn't make sense here, right? Like I shouldn't have a gallbladder attack. I was made to have a gallbladder. Obviously something is wrong. And I thought to ask my doctor at our follow-up after my surgery, and the doctor was like, yeah, no, I mean, everything's healing fine. Everything looks fine. I was like, well, no, I think I need to get healthier. I think I need to lose weight. Because at that point, all I knew about being healthy is losing weight. And he's like, okay, I'll help you with that. At the end of my appointment, he walked out of the room and gave me a Xerox. I'm aging myself there, a black and white copy of the food pyramid. And he's like, here you go. And just sent me on my way. And I'm like,
wow.
Okay, well, if my doctor's not concerned that at 16, I had this horrible gallbladder attack, then obviously maybe it's not that big of a deal.
Right.
But that is false. There's we have studies on how the gallbladder is a tip of the iceberg symptom. Yep. And when I used to give talks, like, pre-COVID, but I used to, like, there'd be 300 people in a room in my city, and I'd be like, and they came to hear me talk about thyroid. I'm like, how many of you guys have had your thyroid removed, or have had had your gallbladder removed, or had a gallbladder issue? And 90% of the room would raise their hand. Yep. There is a serious connection there, and we're missing it if we just cut out this organ and go on our way. But that's what happened to me. I didn't know any better.
And you were just 16, right? Oh my gosh.
Yeah, 16, losing my gallbladder, right? So then 3 years later, I am driving in the car. I'm looking over my shoulder. And my mom's like, oh my gosh, you have this swelling in your neck. Like, it looks like there's something there. And I'm like, oh no, it's no big deal. Like, I feel fine. And moms always know, right?
Moms know. Yep.
Moms know. And she pushed me to go get all this testing done. And I'll never forget, at 19, going to the doctor's office with my mom. And I remember where we were. I was on the doctor's table. My mom was in the corner. Doctor comes in and he's like, I'm sorry to tell you this, but your daughter has cancer, thyroid cancer. But the good news is, if there's a cancer to have, this is the good one, which they still say that to this day.
Right. There's no good cancer.
There's no freaking good cancer, guys. None. Right. But apparently that's supposed to help you feel better, to cut out your vital organ, right? And then at that moment, it was as if I was disconnected from my body. Like, at that point, everything became a blur. I remember, like, it felt like I was watching a movie of my life, because I'm like, how did this happen to me? Like, how am I 19 years old with cancer? Like, this, no one's telling me how this happened or why this happens or anything. Like, I was fearful every day of my life, because I'm like, I can't do anything. Right.
Right.
So they ended up telling me, we'll get this taken care of. Of course, we're going to cut out this vital organ. We're going to give you high dose radiation. And that's the reason they say it's a good cancer, because they can cut out this dynamic, adaptive, important organ and just put you on a pill for the rest of your day. And then I got high dose radiation, which was probably one of the scariest, most hopeless times of my life. I had to get radiated iodine. Oh,
Hold that thought. My dog is squeaking his
yeah, I just heard that.
Sorry.
Oh my gosh, that's so funny. Okay.
Anyway, go ahead. Sorry.
Okay.
High dose radiation.
Yes. So in the hospital, I had to get high dose radiation. So pretty much what that looked like is I was in a gown, and this nurse came to my room, and she had like this modified like hazmat suit. And remember, there's a silver tray with this like silver thing. I mean, like she was all protected, and I'm sitting there like, oh my gosh, like
totally exposed.
Yeah, totally. That's exactly what it was. I was totally exposed.
Yep.
And I took this pill and I had to stay at the hospital. I think it was 1 or 2 nights. If I'm being completely honest, again, I try to block that part of my life out when I felt like a victim, because I didn't want to think about what happened to me. Right.
Mm-hmm.
Okay. So there you go. It was kind of blurred. I didn't want to think about what happened to me. So, but when I sit at the hospital, everything was covered in plastic, the bed, the phone, the floor, everything was covered in plastic, because out of every single hole of my body, I was oozing out radiation.
Right.
And then they sent me on my way, and that was it. That they're like, okay, you're all fixed now. That's it. No why, no how, no anything. And they put me on Synthroid and they sent me on my way. And I remember just kind of being fearful every day, because if this happened to me and there was no cause, then it's going to keep on happening. Like I had no idea what my life was going to look like at 30 or 40 or 50. And then about a year, I started noticing some odd things. Brain fog. Talk about taking back my brain. I had brain fog at like 20 years old, like memory issues. I have all of my old notes where I constantly told my doctor, I'm nervous because I feel like I'm losing my memory. Like I can't remember things, right? My brain was foggy. I was feeling depressed. I would wake up every day, even though I was thankful. I had a great time in college, great family, everything, with this like heaviness I couldn't shake. And then at night I would lay awake, like replaying things and worrying about things that I had no control over. I started losing my period, and I would go to my doctor and I would say these things. I'm like, something doesn't feel right. I don't feel normal. And they would do my thyroid lab and they would do my lab tests, and they're like, well, everything is fine. In fact, I started doing CrossFit. I became a vegan because, of course, like, oh, let me give up meat.
Of course you do.
That's the answer. And I started using it to be very restrictive because I wasn't losing weight and I had all these other issues. I had a doctor finally tell me, well, do you understand calories in, calories out? As if the reason why I was having all these issues is because I was eating too much.
Maybe because you don't have a thyroid.
Yeah, exactly. Maybe it's because they weren't doing the right tests.
Right.
Maybe it's because they were incomplete tests. Maybe because they weren't looking at the right ranges, which is exactly what happened. I actually got into a car accident, went to a doctor of chiropractic's office. They taught me that the body's created to heal itself. It does the right thing at the right time, and that I could get better. Like it was like this weight was lifted off of me, and I decided no one was going to know my health better than me. I drew a line in the sand. I requested all my labs. Back then it was very hard. This was 17 years ago. It was very hard. 16 years ago. It was very hard to like find resources, but I read studies and I listened to other patient experiences, and I put this all together. I looked at my labs, and all those times that I said I was struggling, that something was wrong, I was right. They did not do the right labs. I was not on the right medication for me, since I didn't have a thyroid. So my hormones were out of whack. And when I started advocating for myself, I fired my doctor. I hired a new one that listened to me. My health completely transformed.
That's awesome. And that's what you said right there. You took your health into your own hands.
Mm-hmm.
You fired who wasn't working for you and with you, and then you found somebody who would.
Mm-hmm. Exactly. Yeah.
That's so key. Yeah. So then what happened?
So at that point, I decided I was going to go to school to be an eye doctor. At that point, I decided, heck no, I want to change people's lives, right? And so the biggest thing for me, I talk a lot about firing your doctor. And I had someone following me online one time and they're like, well, you don't need to be mean to the doctors and you don't need to be da da da, all this stuff. And I'm like, listen, when I fired my doctor, it was out of desperation. It was if I don't do this now, if something does not change, right? You have to get to that point. You have to get to a point that you say to yourself, I'm willing to do whatever I need to do to take back my health.
Yep.
I'm willing to do whatever I need to do to be well. And that was it for me. Like at that point, when I realized this was not the right team to help me in my health journey, I was like, I can't do this. It has to change for me because I can't keep living like this. And so I think that was the biggest takeaway for me. It's the biggest thing I carry with me to this day, is that you have to get to that point where you're willing to do whatever, invest whatever, so that your health can look differently. And I'll add this as well, even after I transformed my health, even after, I went to school to become a doctor of chiropractic, I still felt like a victim for years. I felt frustrated. I mean, I remember my first date with my husband, or one of the first dates, we were driving in Atlanta. And I remember because I was so embarrassed, he asked about my scar on my neck and I cried. It was such an open wound for me to know that I went through all of that with so much fear and hopelessness, without any guidance, without any education, without knowing what I knew then. Like I had learned so much about what causes these thyroid growth. I had learned so much about gut health, brain health, hormone health. I knew so much, and I was so angry and frustrated that no one had told me no one told my mom that. We had no idea that we could have done so much more for our health. And I'll add this, in this final thing, I think I'm adding each thing
That's
as I
okay.
remember things. But, I think it was in 2015, Dr. Yuri Nikiforov, I don't want to mess up his name, Dr. Nikiforov, in 2015, he had advocated with like 10 different experts around the world, pathologists, radiologists, to rename a particular type of thyroid cancer. And it was an encapsulated follicular variant papillary carcinoma. So if anyone's listening, go look at your paperwork, see if you've had that or you've been, diagnosed with that. But anyways, and the whole point was to get rid of the C word, the carcinoma, the cancer, because he was saying that because we give it a cancer, the C word, we are being too aggressive with it. You were safer, and you had more risks. You would be safer if you had just left it alone, and you would have more risks going after it with aggressive treatment like surgery and radiation. And that was the cancer I had. So boom, that's another layer of this whole frustrating journey of being stuck in this medical system as a woman of color as well, as someone who didn't have a lot of resources in this medical system where no one was really listening to me and I didn't know where to go, and then finding out all of this. But times are different now, right?
They are. Times are different. Yes. You have a lot of resources at your fingertips. You've got, Dr. Google, where you can find a doctor who can be in your corner, right? So 17 years ago, 16 years ago, I mean, the same thing when I had my cancer diagnosis. People just thought I was nuts for going the path that I went. Like, do you have a death wish kind of thing? Because the C word is so scary to our society as a whole. And I was like, our body's created to heal, just like you. Our body's created to heal. So I know there has to be a better way, right? And so thankfully, now you and I are in this space, and people come to us when they have those challenges. So you're talking about, so they didn't do the right testing with your thyroid. So what should they have done? And what do you do when people come to you with all these thyroid issues?
Yeah. Ooh, so I do have a free ebook. I forgot to mention that, like on my website.
That'll be in the show notes. We'll put that in the show notes.
There you go. Yes, there's
an
ebook. Yes. And I want to say that because in the ebook, there's optimal panel, and then there's the thyroid panel. So I want to clarify that, because people are like, okay, I want to test my thyroid, but I'm like, but you got to test some other stuff as well along with it, right? So I'll just touch on the core thyroid blood work, because I do think there's other blood work that's really, really beneficial. But the core ones is TSH, free T4, free T3, reverse T3, and thyroid antibodies, right?
Mm-hmm.
And you have to get all of those tested. And I think it's wild to me that doctors will not test it because insurance doesn't cover it, or they feel like that you don't need it. I mean, you are the paying individual, right? You're hiring your team of doctors, nurse practitioners, whatever, who best aligns with you to help you get well. And if they're not listening to you and helping you order the tests that you want to order, there's a problem. But yeah, so TSH, that one is pretty easy. Most doctors do it. It used to be considered the gold standard. To some doctors, they say it's the gold standard, but TSH is thyroid stimulating hormone.
Mm-hmm.
It is a pituitary hormone. So that's something you have to understand. It's a hormone that comes from the pituitary, then communicates with the thyroid. So it lets you know with signaling to the brain and how the brain is signaling the thyroid, not what's happening at the thyroid, not what's happening with conversion, not what's happening at a cellular level, right? So you can have a TSH that looks good, quote unquote, but still have problems down the line, right?
Yep.
So that's TSH. And then free T4, which free is really, really important to understand. It's free is what's unbound and available. So there's total T4, but what you want to know is, am I using up my free T4, right? And do I have enough of it? And so your thyroid makes a majority of free T4 and some free T3, but you test free T4 and it gives you an idea of your thyroid output. Like, what is your thyroid producing?
Mm-hmm.
And that free T4 has to be activated. It has to be converted, right, to its active form. Just so you know, there's doctors that will start testing free T4. And the assumption is, well, I just need to test free T4 because your body knows what to do with it. And your body does know what to do with it. It's intelligent. But you wouldn't believe how many people I'm helping. And I'm like, do you have any gut issues? Like, do you feel acid reflux or loose stools or bowel? Or do you feel like you have food sensitivities, rashes? I'll list all these symptoms. And they're like, oh, yeah, no, I definitely have gut issues. How well do you think your liver is? Oh, probably not that great. I've taken medications. You know, I've been in a moldy home. They know that their liver and gut is not going to be healthy. That's where you convert most of your thyroid, thyroid hormones, right?
Yeah. Yeah.
So
and you're not told that in a normal doctor's office.
No. Yeah, exactly. And that's why it's important to then test free T3.
Yeah.
Because free T4 is looking at how much your thyroid is making. Free T3 is looking at how much has been converted, right? So majority of it is done in the liver, some in the gut, and even less in a few other places. But majority of it is going to be liver, then gut. And then that's where you're looking at free T3. Now, another marker, which really doctors and insurance just do not like this marker. I love this marker, is something called reverse T3.
I love it too. And
it's a great marker.
So hard to get run.
Yeah.
So hard to get run for the insurance. Yeah.
It's great. Yeah. It's a great marker. It's a great, like, hey, you're under stress. Hey, there's inflammation. Hey, there's something going on here.
Yep.
Yeah. And of course, yeah. So reverse T3. So when free T4 goes to the liver, you're going to make a majority of free T3. And then as a backup reservoir, you're going to make reverse T3. So it's literally, they're very similar molecularly, just like some places are changed. The reason why you do that is because in times of stress, if you're really sick, if you're in a famine, if you're really in survival mode, or if your body says, hey, we need to slow down this thyroid production to conserve energy, you're going to be okay because you have reverse T3 in times of stress, right?
Mm-hmm.
So that tells you that if you're chronically stressed and you don't know it, guess what's going to start going up? Your reverse T3.
Yeah.
And your reverse T3 will compete with free T3. So you can have issues there between reverse T3 and free T3 that you're missing if you're not testing reverse T3. I think a really big place, I'll add this, is that a lot of people don't realize they're taking too much thyroid medication. Their doctors put them on it. Your body's like, this isn't right. And what you'll see is this reverse T3 start going up.
Mm-hmm.
And that'll start going up. That'll be your first warning sign before you eventually come crashing down from too much thyroid medication.
Yeah. When you say crashing down, what does that look like?
So when it comes crashing down, so like you'll have hyper symptoms, right? A lot of people, you need to understand that there's hyperthyroidism, which is Graves, which is the overproduction of thyroid hormones at the thyroid, or there's just too much thyroid medication. It is not the same thing. You are not hyperthyroid because you have a doctor that's not keeping a better eye on your thyroid medication, right? So I just had that happen recently to someone who doctor kept putting her on higher dosages during pregnancy, and then postpartum, it came crashing and burning. Anxiety, overwhelm, feeling depressed, feeling like sometimes you can feel heart palpitations, you feel like hot, easily agitated, right? These hyper symptoms because there's too much thyroid medication. So that's a big clarification there. And then the final two tests are thyroid globulin antibodies and TPO antibodies. Now this one, oh man, it drives me nuts. I'm sure it does you too. If you test those antibodies, it drives me nuts because so they're thyroid antibodies, which is an autoimmune disorder, which can be Hashimoto's or it can be Graves'. Hashimoto's is hypothyroid. You don't have enough T4, T3. Graves' is hyperthyroid, which is too much T4, T3. But the problem with this is that doctors look at thyroid antibodies as like, okay, we'll test it one time. You have it. Okay. Like that's it. They don't care after that. Yeah. There's not a drug in the market that's going to specifically bring down thyroid antibodies and help repair the thyroid tissue. There isn't. If you have these thyroid antibodies, if you have this thyroid autoimmune disorder and you get on medication, all the medication is doing is it's pretty much ignoring the fact that your thyroid's getting destroyed. It's ignoring the fact that the thyroid isn't working well, and it's giving you the end product so that eventually your thyroid just keeps getting worse, right? And so that is wild. The other reason why it's wild to me is that I need people to understand that just because you have thyroid antibodies, you're not like your thyroid isn't in this separate little enclosed section where thyroid antibodies are only going to affect the thyroid and nothing else. If you have a thyroid autoimmune issue, you have an autoimmune issue. You have an immune imbalance, which is a
head to toe
body
imbalance. Yes.
Head to toe. We know that thyroid antibodies can cross the blood-brain barrier. We know that antibodies can affect the gut. We know studies have found that if you have if you have this one autoimmune disorder, like thyroid autoimmune, you're 3 times as likely to develop more. We're seeing it in studies where there's these connections with celiac and anemia and all these other autoimmune issues. So if all you're doing is just getting the end product, which is the hormone like Synthroid or Armor, and not addressing this immune imbalance, it's going to get worse over time because you have an autoimmune disorder.
And then it shows up in other areas of your body. Yes.
Absolutely. Yeah.
Yep. I love it. That is such great information. So people can download that free ebook. So you have and then
that one goes further.
So what other testing do you recommend?
So in my optimal lab, so I look at vitamin D levels, looking at optimal vitamin D levels, because we have found there's one study that found that vitamin D deficiency creates an imbalance in your humoral immunity, which is your Th1, Th2, which is connected with Hashimoto's, right? Or thyroid autoimmunity. So having adequate vitamin D levels, looking at iron, not just iron and not just ferritin, but iron panel and ferritin. I have found, and this is a whole nother topic, the connection between like gut issues and thyroid and how the thyroid creates gut issues and vice versa. But a lot of people, it's hard to find the right thyroid dose, or it's hard to feel well, even if you get your thyroid hormones well, if your iron and ferritin is not well, because that deficiency, anemia or suboptimal levels, creates the same type of symptoms as hypothyroidism, like that brain fog, those hair changes, the fatigue. You can see that if your iron and ferritin is not optimal.
And some of those aren't checked. People think, oh, my thyroid is still off. My thyroid is still off. And so you're chasing this thyroid, you're running on that hamster thyroid wheel. And when there is something definitely systemic going on.
Yes, exactly. And that's why it's important. Looking at CBC, CMP, I look at metabolic numbers. You wouldn't believe how many women have come in not knowing that I don't even say pre-diabetic, like they're diabetic. Their A1C is not optimal. They're over 100 and they had no idea. That's why they feel so swollen. That's why they feel so inflamed. And they write off every bad symptom to the thyroid. And then at that point, I will tell you this. There is a question that people are always shocked when they see me, right? I say, is the thyroid the primary issue, or is it because of? Is your
Mm-hmm.
thyroid going haywire because you have a blood sugar imbalance that has been there for who knows how
Who
long,
knows how long?
right? Vitamin D deficiency, gut issues that are bringing down iron and ferritin. The thyroid is always going to, it's always going to be a symptom of a sick body, but is it the thyroid that we need to work on, or do we need to work on all these other things? And that will get your thyroid balanced. So getting like a full panel, and Laura, I'm sure you've seen it. Have you had people bring in blood work where they're like, oh, I did my wellness blood work, like their yearly blood work with their doctors, and it's like 3 things. And I'm like, I mean, good thing to know you're not dead, but
Right.
you just want to not die, or do you want to be optimal, you know?
Optimal health. Yeah, exactly.
Yeah.
Yeah, I'm
So
like, this doesn't quite cut it. We need a little bit
yeah.
more,
Yeah,
right? We
exactly.
need an
Yeah.
extensive list. Yeah.
Yeah, exactly.
Yeah, I think ferritin is so key because you can't make proper thyroid hormone if your ferritin's a 6.
Mm-hmm.
Same with
Mm-hmm.
neurotransmitters. When I'm looking at neurotransmitters, if your ferritin is a 12, well, you can't make proper neurotransmitters, and your thyroid surely isn't going to work well. And then you can't make proper neurotransmitters. You can't convert. You can't your digestion. I mean, we could go
Yeah.
on and on and on. It's just one
No, yeah.
big hamster wheel that you just keep
Mm-hmm.
going on. So you have to address everything head to toe. We're definitely top down people, and we got to
Mm-hmm.
get going there. So those are the labs that you look at, and then finish your story, because so you had your thyroid out, you're on this hamster wheel, like, what do I do? You
Mm-hmm.
started figuring things out, and then, like, where are you now? Because you're 2 kids in, right?
Mm-hmm.
So you have 2 kids. I mean, people said you may not be able to get pregnant. I don't know what your story is,
Yep.
because your endocrine
Yep.
system is so messed up. I mean,
Yep.
where did it go from there? Because there's so many pieces to that story where
Mm-hmm.
women lose so much hope. Well, had
Mm-hmm.
my thyroid out, so my hormones are never going to be well. My estrogen, my progesterone are tanked. I can never get pregnant unless we do in
Yeah.
vitro, and then that's a
Mm-hmm.
whole other story. So, hormonal wise, with the thyroid, what does that look like for you since then?
Yeah. So first I'll tell you kind of like what happened with my hormones. And then you asked a really good question that I haven't shared anywhere, even on a podcast, that I want to touch on about what it's like living without a thyroid that we don't
Great, I would love
really
that, because
talk about. Yeah.
it's a real story.
Yeah. Yeah. I'll tell you this. I'm very, 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 very passionate about either helping people heal after thyroidectomy or helping them avoid a thyroidectomy. But I will tell you this, at the numbers we're seeing, it makes no sense. It's all, that's a whole nother, I'll touch on that later, but it's an environmental thing, right?
Right.
We're seeing more and more people with thyroid nodules, right? It's a toxicity thing. It's a nutrient thing, right? But the scary thing is that most people don't realize how likely it is for them to end up in their doctor's office and hear that they have thyroid cancer, or hear that they should cut out their thyroid.
Mm.
And every single person, I will say 99% of the people that have done a consult with me, that have had their thyroid removed recently, or were just told they needed the thyroid removed, sat in front of me virtually or in person and were like, I had no idea. I had no symptoms.
Right.
I didn't even know where the thyroid was. So if people, right, if you don't realize that if you're not actively yeah, anyone can get it, because we live in a toxic world, male, female, there isn't like an avatar for this anymore. Anyone can get it. But so it's important to understand that. So for me, after I had my thyroid removed, because doctors really sell it as a very kind of like, you get to live, but what's quality of life after, losing a vital organ? But for me, you're completely right. I was very nervous about what my fertility would look like, especially since the thyroid hormones are so delicately, like, they're connected to your sex hormones, right?
Mm-hmm.
And so for me, I'm going to put this disclaimer out there. I had to heal first from my surgery and my radiation exposure and from the mistreatment of care. And then I had to heal from what originally caused the problem in the first place.
Got it.
Which I did. I had severe gut issues, and toxicity, heavy metal toxicity, which I didn't have any mercury in my mouth, but my mercury levels were through the roof. My mom had like 7, and we see connection with that between mom and kid. So I had to, it takes time, right, to heal. And so I think one thing that really worked for me, that a lot of women don't understand when it comes to fertility, is that you will get pregnant when you are well, right?
Yeah.
When you are well. A lot of women are not well. They've struggled with periods, or they've been on birth control. They struggle with depression and anxiety. and they don't realize how that's all connected. It's not that something is wrong with you, is that you have gotten the wrong care, you have gotten the wrong information. And so for me, I had to push off getting pregnant because I said to myself, I have to be well. I have to look at my hormones, and I need to know that my hormones are well, that I'm making progesterone, that I'm making estrogen. And I had to work on that. And it's unheard of. Like when people knew I was waiting to have a baby, they're, oh, you can't have, no, it's not that. It's that I have to be well. I have to be well in order to get pregnant. And it worked, right? Because I had a baby, like I had two babies. I had a baby and then I got pregnant at 9 months, right? So which was kind of planned, but crazy because we didn't think about the long-term, craziness of having kids that close. But I think a lot of women, their doctors don't prioritize their overall health. And that's what I had to learn for myself. So that's kind of like how my hormone health changed.
Yeah, that's a big deal. And I want you to go back and restate that too, because there are so many women out there who are struggling with fertility, right?
Yeah.
And they're going down that fertility path when they really need to be heading down the wellness path for their body, because it's going to be so much better for them 10, 20, 30 years down the road if they get their body well first, then they have their baby, right? So we're pushing, and I can't imagine how hard it is to be waiting to have a baby. So I am not belittling that at all in any way, shape, or form. I have 8 years between my kids. And at the same time, for the health of yourself long-term, and then the health of your child long-term, to get your body to a place of wellness before you add that human being inside of you, I think is key. And I want you just to kind of reiterate that, because especially when you have an endocrine challenge, or you're missing a vital organ, 2 vital organs really for you, your gallbladder and your thyroid, like that's such a journey. And it's such an emotional journey at the same time. It's not just physical, it's emotional and it's spiritual, really.
Yeah, no, it is. And it's really hard. It is really hard having to wait. That it really does suck, whether you're waiting on purpose or whether it's happening not on purpose. That really sucks. But you might open a whole door here, because this is something that I am very passionate about. There is gender bias in medicine. We know it in studies. We know that if you're a woman having menstrual pain, you are more likely to leave with a prescription for antidepressant or anxiety medication over a male that comes in and says he has pain in his back, because obviously it can't be that bad. I think, going back to what I said about your ability to be well, we as women are not taught how incredible our bodies are, and how our sex hormones, which is deeply connected to our adrenals, and it's deeply connected to our thyroid, and it's deeply connected to our brain, and then our gut, right? But like the brain, sex hormones, adrenal, and thyroid hormones, it's this deep connection where they're going to influence each other. But we're not really taught how to listen to our bodies, and we're not taught. The only time I remember in school, this is how I got exposed to it, because I'm going to share a book that I absolutely love. In school, I had to take obstetrics, like that was a class, OBGYN, and he was raffling off like this book, and it was a thick book, and he was talking about this woman and how incredible she was, and this guy won it, and I was like, what? And so after class, I went to his office and I was like, hey, I was really interested in the book. He's like, oh, here, have a copy. And it was called Taking Charge of Your Fertility. And if you do not have that book, everyone needs to get that book. She's the grandmother of all the women that teach now on they all know her, right? Tony Rush. But
we'll put that in the show notes too.
Yes. Incredible.
Taking Charge of Fertility. Got it.
Yeah. And it was the first time where I was like, wait a minute, hold up. Your period, let me go ahead and say this, your menstrual cycle, which is day 1 bleed to day 1 bleed, has everything to do with who you are as a person, not as a woman, as a human being, how you view the world. Do you feel emotionally stable? Your ability to go after goals, your ability to feel good in your body, in your life, your ability to put on muscle, your ability to fight Alzheimer's and dementia, to fight heart disease. It's all associated with your sex hormones. But what are we taught about sex hormones? It's periods, and ew, gross, or if you're having bad periods, too bad, or get on birth control. And fertility. And that's it. Like, try not to get pregnant. If you don't want to get pregnant, if you do want to get pregnant, this is how you get pregnant, right? That's all we're taught. We're never taught that in the first part of our menstrual cycle, we are more driven. We should have more testosterone, a higher sex drive. We can have more clarity, right? That a period should be uneventful.
Right.
Women that come to see me, they're like, what do you mean uneventful? No, I'm saying uneventful, literally like you get your period and it's like, oh, I have my period.
No big deal. Mm-hmm.
No big deal. Not
Yeah.
that's we have normalized abnormal things for women and we've written it off as being a woman, right?
Right.
And so we have women that struggle. And then like we're talking about the brain, you know, you have to ovulate. But I have women in their 60s. I haven't had no idea that ovulation, yes, release the egg, yes, make progesterone to sustain pregnancy, but progesterone works on GABA receptors in the brain.
Mm-hmm.
Your calmness, your ability to fall asleep at night and to feel stable. How many women have you worked with that are anxious or depressed or get headaches or get agitated and they feel horrible? They beat themselves up because they yell at their husbands or they yell at their kids and they don't understand why they're doing what they're doing.
Right.
And it's affecting their brains.
Yeah,
All
no woman wakes up and
hormones.
says, I want to be this way in the morning. So it shouldn't be normalized because that's not normally who we are. That's not who we're created to be. That's not the way our body is supposed to function.
Exactly.
Yeah.
And so for me, when I found that out, I was like, okay, well, that would make sense why, like, first of all, my thyroid affects every single cell in the body. I lost my period because my thyroid hormones were low. But then I was like, I need to be optimal though. I need to, because I used to get horrible cramping, pain. I remember thinking one time in college, like, I'm taking like 8 Midol. Is this safe? Like, I was like, yeah, I don't care.
I used to take hydrocodone. My periods.
Oh my God. Yes.
Yeah.
How insane is it? Oh yeah, just
I know. And that's just how it is. That, you know, my mom was that way, blah, blah, blah. The whole family was that way. So we just take hydrocodone when we have our period for the first 2 days. Great idea.
Gosh, that's insane.
Yeah.
Yeah. And so this idea that like we only have these serious conversations about our menstrual cycles, which again, it's not just bleeding, it's a whole month. Like it's a whole like 25 days, 28 days, 30 days, depending how long your cycle is. And that we only think about it when we need to get pregnant. And what most women don't understand either, like there's all this struggle with like, you know, infertility now. And I have so many stories talking, even recently I had 2 women that gave birth that had multiple miscarriages because their progesterone was low. I had to tell them talk to the doctor a certain way. Their doctor was like, I guess, sir. And then they just had 2 babies, like these 2 different women. But you know, going back to like all of that with the hormones and the thing that most women don't understand is that, so let's say you do get IVF, let's say you do end up getting pregnant, you've got to take into consideration, you know, Kelly Kennedy, lymphatic, she sat down and she talked to me. She goes, listen, kids are parasites. They're parasites. They're going to suck you dry. That's what they are. And most women don't understand that. Like when you're growing that baby's going to get the nutrients. At the cost of who? You. They're going to get those minerals. They're going to get those vitamins. They're going to get those nutrients. They're pulling it from you. And then you give birth, which is like transformative. You lose this organ, which is a placenta. And now you're nutrient depleted. Now you probably have some iron. And then sometimes, you know, that's when that thyroid issue comes to the surface and gets worse. And then we have these women that are depleted during motherhood and they have no idea why. The same issues that you had before. So it's looking at the body as a whole, looking at what your sex hormones are telling you, looking at what your thyroid levels are telling you, and working with that. And that taking charge of your fertility, another amazing thing about that book is that it teaches you fertility signs. So you know where you're at in your cycle. Like you can know if you've ovulated, if you haven't. It'll let you know. For me, that's why I said people are like, oh, was it planned? I'm like, listen, I cannot not plan a pregnancy. I know my body. I've been doing it for 10 years now. Like I know my body. I know when I ovulate, like I know, right? But it took time to work on balancing those hormones. Right.
And fertility is so much more than just your hormones too. It's a state of being of who you are. So when we compartmentalize fertility just to can I get pregnant or not, it's such an injustice to us as women as a whole. You know, I mean, womanhood is under attack right now anyway, and so we've had this we just get so compartmentalized, and it just frustrates me so much. So I love the fact that we're having this conversation, and thank you for exposing all of this.
Yeah. I get frustrated. Like just in the last couple of months, women that have had these multiple, I'll give you one example. Like there's a woman in my office, I'm about to try to do an interview with her, but anyways, like her adrenals were a mess. She was just depleted, right? And by the time she came to see me, she had had 2 miscarriages. But anyways, this last one, I don't treat, I don't prescribe. I'm not an OBGYN. I usually try to refer out to people that are like-minded. But she was seeing an OBGYN where I presented her with a study that says that women that have had multiple miscarriages, I can give you the link, you can put it in the notes.
Perfect. I would love that. Yes.
If they've had multiple miscarriages, at what levels they should maintain their progesterone. They are not like women that have had 0 miscarriages. Their progesterone should be at higher levels. And this doctor was like, no. And I was like, what? I mean, the study's here and you've had multiple miscarriages and no one's really giving you any guidance. Anyways, she tried to go out of cream. Anyways, had a miscarriage. And so I had to sit her down. She got pregnant again after that. And I had to sit her down, had a come to Jesus moment. Like, you are in charge. You have this study. I did Dutch test on her. I saw progesterone levels were not good. I saw that her adrenals were not good. And you know what she did? She said, okay, I'm done. She fired that OBGYN, went to another one. She came with studies. She came with like notes that I gave her. And the doctor was like, well, I don't know if this is actually, I don't think it would actually help, but we can do it. And not only did she do it, but increased it and kept an eye on her. She took all the supplements to help her with her adrenals and had a beautiful baby girl. But the thing is,
praise God.
Yeah, exactly. It's incredible. But the thing is, you are like, you are it, right? You know your body. And that's the most important thing I tell women. Like, you are the expert. I can have all the studies, I can have all the clinical experience, but like, you live in your body. You know if something's off. You know if you're depleted. You know that something's not right. You have to trust that. And I'll say one more thing. There's I just had a Dr. Boots Taylor. He's out of Atlanta. He is a fetal medicine doctor who practiced for decades, and they came after him, attacking him because he's a military guy, black guy, bald head. Like, he looks like he could be, but oh my gosh, the way he advocates for mother-centered care. But he and he has a whole program to like help women find their voice in a doctor's office. And I was in a talk with him, and he talked about how like women, he would see women have all these questions and all these things they want to discuss with their doctor, and then they go in and then they kind of like don't, right? Like their doctor says, no, you don't need that, no, and then they leave, they're kind of deflated, like, well, I came here for this and now I left not with this. And he was talking about how you've got to find your voice and you got to go in there, and if someone's not going to respect you or have a conversation with you and look into things with you, then you need to find someone who does. And I'm like, and this is coming from a doctor that has lived it, right? That's done hospitals and all these things. And you just got to trust. You don't have to be the smartest person in the room. You don't need all these degrees, because you are it. You live in your body and you deserve to be well.
Right. You have your own degree about your own body.
Yes, exactly. Yeah.
Yes. This is so good, Rebecca. So good. What else do you want to share with our listeners today?
Well, yeah, the one thing, so you had asked, like, how is it now? Like, it's been 17 years.
Yeah.
I'm going to be real.
Yeah.
It sucks. There's not a day in my life where I don't think to myself or say to my husband, I wish I had a thyroid. And this might not be for everyone. You might have a listener that's like, I'm so happy I took out my thyroid. Most of the time I find that those people are usually just a couple of years out from their surgery, but I hate it. But I will say this, Dr. Pompa, like our mentor, like Dr. Pompa,
our mentor is Dr. Pompa. Yes.
Yes. Pain to purpose, right? Like being able to use this pain, because I feel so sad that no one talked to that 19-year-old's mother or that 16-year-old's mother. And that's why I do what I do. And so these are some of the things that you don't take into consideration, because this is the thing, like the same thing's happening with hysterectomies, right? Actually, I don't know if they do this with men, but like hysterectomy, they're like, oh yeah, you don't need it, they just cut it out. But there's no long-term studies on the effects of quality of life, not just death, quality of life. for the people that have these surgeries, for the, women that have these surgeries. And for me, there's no blueprint for living without a thyroid as a woman 17 years post thyroidectomy. Like, I am it, like, and it's not easy. Every few years through hormesis, I'm sure you'll touch on that or talk about that at some point, through, the hormetic curve, this idea that your body, you can introduce a stressor to the body, which has a benefits until it doesn't, until it can weaken the system. And then you have to diversify, right? And it was when I learned about that I was like, oh, that's what's been happening to me. Every couple of years, I can be on the best medication dose, I can be on the right amount, but it stops working.
Sure.
It just doesn't. And then I start all over, right? I go hypothyroid, and then I have to redose, and redosing takes time. You can only get blood work done every 6 weeks, right? To find out your baseline. So it's not easy. And I always have to pay attention to it. Obviously, I'm a pharmaceutical patient for the rest of my life. My husband, who's also a doctor, is not allowed to go with me to the pharmacy anymore. You wouldn't believe how many arguments we've had, because like, they'll change my medication, right? I'm a doctor. I know that if I feel good on this, I need to stay on this, and I'm going to say that, or, so it's a struggle, but I truly believe that I hope my story helps either someone pause a moment before jumping in under a knife or taking something severe, and understand that you should not make, this is a big thing, you should not make decisions out of fear.
Right.
You should not make decisions for your health care under hopelessness or fear. You should not. There's no way to be rational when you're in a sympathetic state. Mentally, you're not rational, right? So maybe that, my story can help someone say, okay, wait a minute, let me slow down, and maybe there's some other options, right? And for those, I always tell the people I coach that have their thyroid, I'm like, listen, the cool thing is that you'll get to be better than me when it comes to your health, because I always have a missing organ, right?
Right.
So the idea is that no matter how bad it gets, right? No matter how bad it gets, there's always hope, because the miracle isn't when you get well, right? The miracle wasn't when you got well. The miracle was the day you were created.
Amen.
The day you were created in the womb, when you were given all of that potential to heal that stayed with you, that was taken away from you, because we're taught that our bodies are these broken down machines, right? We need all this outside help. Even if you were told different messaging, even if you were lied to, it was still there. And so the miracle is just reconnecting with that, understanding what stressors are blocking that, removing those stressors, and allowing your body to heal. And the last thing is this: it is a process, right, Laurie?
Right.
It's a process. Not a fast one. I just got a question today. Hey, how do I get my thyroid levels? My assistant told me, like, someone had a question, how do I get my thyroid levels optimal? I'm like, I mean, that's a loaded question. Are you toxic? Is it mold? Is it this? And then once you get those levels, like, it's a process. So if we can reframe our thinking of what is health? Health is not this place, a destination, right? Health is that, I hope everyone understands, health is that 10 years from now, you're better than when you were today. Meaning, as you age, you actually feel better, function better, right? It's not just coming off of medication, because once you come off medication, you still are living in a very stressful, toxic world. It's how do I keep getting better? And I go against the status quo when it comes to health in America.
Yeah. And I will say, I feel way better than I did 10 years ago.
Me too.
Yeah.
Yeah.
It's
Me
great. The
too.
older I get, the better I feel. And I'm so excited. Yeah.
Yeah. Same.
Wow. This has been an incredible interview, chat. This has been amazing. We're going to have to do this again, Rebecca.
Yes, absolutely. Just let me know.
Because I love how we started with thyroid, and then we ended with, who you're created to be, and, the emotional components, and just fertility. And it is such an important conversation, and there's so many more components to it, because, we're both advocates for women, and that's, mainly the people who come to us are women. And so I really do feel we get mistreated in the traditional medical system, and, not a lot of fault to a lot of those doctors. That's the way they're trained. That's what they know. And that's why we have to take, matters into our own hands and say, no, I deserve better. I know my body can do better. And then we work on those things. So thank you so much for being also sharing your story and just giving so much hope. And that's what this is all about, is just giving hope and tools and resources to empower those who are listening to us. So Thank you very much. And we will see you on the next episode.